In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
I'm in the Charité Hospital in the heart of Berlin at the Department of Dermatology with Professor Maurer. Thanks for inviting me. And you're an expert in urticaria. Normally, when I press on my skin, nothing happens at all. But in patients with hives, it's totally different. Why is that?
The reason for this is that they have urticaria, chronic inducible urticaria, which means that you can induce hives or angioedema by external triggers. Pressure is one of them, sunlight is one of them, cold and others. And this is a chronic disease, so many of these patients have problems for months and years.
And what actually happens in the skin?
The cells in the skin that are meant to protect us from danger coming from the outside overreact. They're hypersensitive to triggers such as cold or pressure, and they produce a defense reaction, an inflammatory reaction, which then manifests with wheals or with hives, with redness, with itch and angioedema.
So this sounds to me like it's a kind of allergic reaction because the immune system fights the own tissue of the body. So is it kind of allergy?
Well, it looks like an allergy, and in the end you go to an allergologist and he gives you an anti-allergic drug. So there are many similarities. The difference is that in urticaria, the immune system is not involved in the way that it is in allergies. We don't have antibodies to environmental allergens such as pollen or foods in patients with urticaria that are responsible for their problems. It's other underlying causes that lead to chronic urticaria.
Is the skin the only target organ which is affected by urticaria?
This is a very good question because we know that mast cells are the responsible cells for urticaria, and we have mast cells not only in the skin but also in the airways and in the gut. So why is it that only the skin mast cells release their histamine and make problems? We don't know yet, but a lot of research projects are focused on that, so I hope we will have an answer in the future.
So if only the skin is affected and it's itchy a little bit, I say a little bit, so these are the only symptoms for the patient. Is it a severe disease nonetheless?
Yeah, this is a very severe disease, and the main reason for this is that patients are very itchy. These hives and the other symptoms that come with urticaria are immensely itchy, and you can't sleep when you have urticaria, you can't work, you can't focus, you can't concentrate, and you have this every day or almost every day for a long time. So it's one of the worst skin diseases that you can have.
Usually it takes a long time until the diagnosis is made. Why is that? Is it so difficult to diagnose this disease?
Well, it's not that difficult to diagnose. When you have hives or angioedema, urticaria is the most likely explanation for this. So diagnosis is not the main challenge. Treating these patients well is what they need a good doctor, what they need a good allergologist or dermatologist for.
Right, so how do you diagnose it actually?
By looking at the skin, when there are hives or angioedema, we can diagnose urticaria in most patients. The problem sometimes is that patients, when they're in my office, they don't have the hives, they don't have the angioedema. So we need good pictures, good documentation of what the skin looks like, and then it's not that hard to diagnose.
Professor Maurer, patients actually can die from a cold urticaria.
That is correct. It's one of the most dangerous forms of chronic urticaria. Why? Patients swim, they go into cold water, their skin mast cells react, they release a lot of histamine which goes to all parts of the body, including the brain. They get like an allergic shock and they become unconscious and they drown. The second dangerous situation is when patients drink something that's colder than they tolerate or eat ice cream. Then their tongue starts to swell, the airways get tight, and they can suffocate from this urticaria reaction.
You got a patient on your ward with cold urticaria, and you invited us to join you during the consultation.
That's right. Let's do it. Hi.
Hi, hello, Carsten. Nice meeting you. Hi. Monica's our patient, and she suffers from urticaria, and she doesn't speak English, so I do the talk in German. And I ask questions like, when did it first start? Wann haben Sie denn das erste Mal gemerkt, dass Sie an Urtikaria leiden?
It was about 30 years ago. I was working for the police force and was outside all the time. And after a while, I started getting this puffiness and itching. And that's when I found out.
Aber Sie
oder
wussten,
gemerkt.
aber Sie wussten nicht gleich, dass es sich um Urtikaria handelt. She didn't know that it was a kind of urticaria.
Nein, wusste ich
No,
nicht. Das
I
wusste
didn't know
ja,
that.
selbst
Not
die
even the
Hausarzt.
dermatologist knew that.
Dann habe ich
It was
meine
only here
Hilfe
that I got help.
hier bekommen.
The normal dermatologists are not so well informed about this kind of condition and didn't really know how to treat it either.
Was so großartig machen sollen.
So now you're in the department of Professor Maurer, and you developed a machine who helps you in diagnosing cold urticaria.
That's right. With our partners, we developed a machine that allows us to diagnose and test patients with cold urticaria. It's right here, so we can see how it works.
Okay, let's do this.
This is the device to test the critical temperature threshold. A machine, a device that produces all temperatures from 4 degrees to 44 degrees. We can expose the skin of the patient to all these different temperatures to see what is the warmest cold that is sufficient for you to produce a wheal. What I need from you is your arm. We will put the arm for 5 minutes onto this device, and we will wait now. Afterwards, we will take the arm off, and we will see by the length of the wheel what your individual temperature threshold is. This is important for patients because they can better avoid temperatures that are dangerous for them. We do this, then provide treatment, and then do it again, so that we can see if we have lowered the temperature threshold and protected our patients from this hypersensitivity to cold.
So do we see anything right now?
Well, now we have to wait a little bit because
switch off the machine.
yes, you can, of course.
Yeah.
You can not see much now, and that is because now the skin starts to develop the wheals. And in 5-10 minutes, we will see a wheal that will start here. Here, and depending on how long the wheel will be, we can measure with this the sensitivity of the patient.
Yeah. And how does it feel if you put your arm on the machine? Is it very cold or is it painful?
At first it's not cold, but after about 5 minutes it starts to get itchy. That's what's happening right now. I'd like to scratch myself now, but I'm not allowed to. And after about 10 minutes, the rash will probably start to appear.
Tell us something about the modern forms of treatment of this kind of urticaria.
Well, the first treatment happened right now. We can tell Frau Köcke in 5 minutes what is her threshold, and she can better avoid the cold that is critical for her. One of the standard treatments we use are non-sedating modern antihistamines that block the histamine and therefore the development of wheals.
And what happens if the anti-allergic medication doesn't work?
One very effective way to treat cold urticaria is the use of an antibody, anti-IgE antibody, which is given subcutaneously, injected into the skin every 4 weeks, and can prevent wheals and angioedema in most cold urticaria patients treated with this treatment.
So I guess the time is over for the test and we can see what the results are.
We can see the wheal already, and if I pull apart the skin a little bit, you can see here in the middle this hive, probably very itchy. And what we do is we take our template, we put the template onto the hive, and then we see, yes, up to 17 degrees Celsius. That's your critical temperature threshold, so anything that's 17 degrees cold or colder will produce these wheals.
That's a very accurate and impressive test. Thank you so much for inviting me into your clinic, and thank you for sharing your story with us.